Does it cost anything for you to get onto Medicare when you turn 65? Let's get right into this. Hello, YouTube community. This is Christian Brindle, Medicare Health Plan expert and specialist. And today I'm going to answer the question, does it cost anything for you to get onto Medicare? So to answer that question, we first have to talk about the two parts of Medicare that come from the government. So because this is vital to answering this question. So when you get onto Medicare, there's two parts of Medicare. There's Medicare Part A and you have Medicare Part B, both of which are provided by the government. And also the only thing, by the way, when you get onto Medicare that actually does come from the government. When you get onto Medicare, you hear about all these different working parts like Medicare Part A, Part B, Part C, Part D, all these different working parts. But Medicare Parts A and B are the only two parts that actually come from the government. Now, Medicare Part A does not cost you anything when you turn 65 and get on to Medicare, as long as you've worked in the United States for at least 10 years of your life, or 40 quarters, whichever you prefer. So, and the reason why it doesn't cost anything is if you've worked 10 years in your life in the country, is because you've paid for it over that 10 years time span in your life. When you are working throughout your working life, your employer automatically withholds what's known as FICA taxes, Medicare and Social Security taxes. So those taxes for FICA pay for Medicare Part A, which in turn means you don't have to pay any more for it when you get on to Medicare. That is all that FICA pays for, by the way. Medicare Part B, on the other hand, has a monthly premium attached to it of $148.50 per month per person on Medicare, as I'm talking to you about this now in 2021. Now, if you're in a higher tax bracket, let's say you make a little bit of a higher income than most people will, they can issue you what's known as a income-related monthly adjustment, or IRMA for short. Income-related monthly adjustments essentially means they charge you more for Medicare Part B than the $148.50 a month. On the flip side, if you are low income and you qualify for your state's Medicaid program, essentially, you may qualify for your state to pay for your Medicare Part B premium for you. So those are two exceptions to that rule of that Medicare Part B premium. But outside of those two exceptions, everybody on Medicare pays the $148.50 per month premium for Medicare Part B. And people always ask, why do I have to pay for Medicare? I thought I was paying into it throughout my whole life. Like I mentioned earlier in this video, your FICA taxes throughout your working life paid for Medicare Part A, not for Medicare Part B, and anything you add additional to your Medicare, like maybe a Medicare supplement, or maybe a Medicare Part D prescription drug plan, or maybe even a Medicare Advantage plan. Some Medicare Advantage plans come at $0 premium costs because they're federally funded by the government, but there are some Medicare Advantage plans that do cost $20, $30, $40, $50, $60, $70 a month in premium, depending on where you might live. So anything like that you're adding on that's additional to your Medicare will cost you additional money on top of your Medicare Part B premium. Thanks so much for watching this video, everybody. If you found this information helpful, if we answered your question on this video, please let us know. Drop a like on the video. Comment what your thoughts are on the video. Do you think it's fair that you have to pay for Medicare, or does it not bother you too much? Let us know. I want to hear your thoughts. Make sure to subscribe for future Medicare and insurance-based information. And also, if you'd like to work with my company, Christian Brindle Insurance Services, on your Medicare health plan, there's a list of what states we're licensed to work with people in down in the description, along with our phone number. We'd love to be able to talk to you and hear from you. We can work with pretty much all of the biggest insurance companies in the industry today. Until next time, folks, thanks so much for watching. Take care. Have a great rest of your week, and we'll see you next time. Thanks so much for watching. If you enjoyed this video, make sure to drop a like on the video, comment your thoughts, and make sure to subscribe for future insurance and Medicare information.